with COVID, you mentioned COVID earlier, working in the ED, a lot of COVID patients. How has that changed the way that you move and work inside of the hospital currently?
Yeah, man, it's been crazy. From the entire start of it, the ED pharmacists were the only ones that were still on the unit because I can't do my job, effectively. I would say from distance and from home. So when it comes to PPE and make sure you're having all your gear on, I go to work with N95s, face masks, head shield. As far as just my equipment is changed, and I'm wearing these things all day. I think it's interesting, and people get frustrated from wearing a mask when they go out and stuff. I'm wearing these things full gear for 11, 13, 14 hours a day. And as far as like the involvement I have beforehand, I would be basically any sick patient in the emergency department. I was in the room looking at the patient, getting an assessment, asking questions, getting medication histories, doing those things. That's changed now. A lot of that stuff happens. We have a brief second to get in the room and look at the patient. But for the most part, for cardiac arrest, I'm used to being in the room doing my thing. They've moved the code card outside. So now we're passing meds in. As far as it's just a lot of processes and protocols has been modified to make sure we're wasting medication appropriately. If you have a patient that's COVID positive, we have to waste that medication now because we can't bring it outside the room anymore because we just don't want to contaminate people. So I think just how I move has been different, being more cautious. Again, one of the things that I pride myself on is being a team player, but sometimes some of the non-pharmacy tasks that I would do, put a patient on a monitor, do CPR, listen for breath sounds after intubation, like all these non-pharmacy things that is helpful, but not necessary. You have to cut some of those things out to make sure that you're taking on the role of understanding how to manage these medications, not just from a clinical standpoint, but just from just being clean, like what goes in, what goes out, and how to monitor these patients, because COVID presents a different subset of patient. They respond differently to sedation. They respond differently to the therapies that we provide, acutely. So it's just understanding a different patient subset, understanding different processes and protocols that are occurring, and just the equipment and just dealing with the emotional part of COVID. Most people don't talk about that. Our nurses and our physician colleagues are struggle mentally with this because you don't just go to work and come home and everything's fine. Yeah. You gotta take all your clothes off outside of your home and wash them and sterilize them before going in. There are some people who are not seeing their spouses and seeing their families because, when we had our highest peak of COVID, we know we were seeing 5, 6, 10 patients per day that had COVID, and that has changed. Families are being, sent to stay with their grandparents and mother-in-laws, things of that nature, just to prevent the exposure. And it's taken a mental drain. So I think it's not necessarily work-related, but I think understanding the emotional component of that, what people are going through, and then the politicizing of everything that we're doing with COVID, people thinking that it's real, it's not real, the medications work, they don't work, and the emotional toll that this is taking on the staff and is taking on just all of us in general has been challenging. And I think being supportive of the colleagues has been another component that we've had to step up recently, because it's been a long time. This has been going on for a while, and everyone's tired of it. And we don't have more PPE. We don't have super effective drugs, even though we say we have these magic bullets. The evidence just doesn't always pan out. And just dealing with the questions, because sometimes you have medical professions who are very involved in politics, and that the evidence that comes with certain things are sometimes jaded. Sometimes the information is shaded to fit one party versus the other, and I can care less whether you're left or right or up or down. I just want to take care of my patient, and sometimes you have to answer questions that are due to the media and due to politics, and all of that has been challenging alongside with everything else that's going on in the world right now.
Man, you said a couple great things in there that I want to touch on a little more. Number one is like the emotional drain. I'm a retail pharmacist, work at a big chain, and having to do this every day. When when you came in here and you said you guys are bonding with your colleagues and you guys have to go home and script down and sanitize and everything before you go in the house. How are you doing with this right now?
Yeah,
Personally.
it's challenging, you know. When I everything that I always have a separate pair of clothing that I have with me that we can swap out before getting in, because I don't want to expose my family to something. Every washing your clothes every day, that's a different vibe, you know. Again, everyone has their thing. That's just every time I come out, my uniform goes in a wash and dryer. It gets sprayed down, wash and dryer every single day. So that's challenging. And then just emotionally understanding that only thing I said, I've been fortunate to grow up in tough times, grow up in tough environments, to where a lot of the coping mechanisms that and the strategies I've had growing up, not having a lot, seeing a lot of difficult things, being in very difficult situations, has helped me stay strong in times now where you say, well, I've dealt with hard things before, I can deal with this now. And it just reminds me of, you know, living in poverty. You know, you can't go nowhere. You're stuck in, you know, you don't have the resources to go places. The economy is bad. You know, for me, this is just, people say COVID is ghetto, but this is really what it feels like in my head. You know, you can't do the things you want to do. You're limited resources and you have to be extra cautious of everything you do. This reminds me of living in a bad environment. And I think that having that experience before, having people who I grew up with, who's doing well, who's going through the same thing, and bonding with them, has led to me being able to say, I can do this. And I've always been a team player. I played sports growing up. And for me, this is just another, you know, team sport that you go in and you compete every day. And to get the dub is to get out of there mentally intact and your patients taken care of. And that's how I go to work for my teammates. I push hard for my teammates, and that's what wakes me up. That's what keeps me going. And that's what's been the bright side of this. For every struggle, there's something that's just beautiful to come out of it. I've been able to bond with people who I didn't think I could bond with before. And I've been able to accomplish some things that I didn't think I could before, simply due to the fact that we're all just trying to get through.
That's dope. That's dope. Because you're in there dealing with these COVID patients on a daily or regularly, how often do you guys get tested? Or how often do the hospital give testing to all the staff and employees?
So that's the challenging part now. Again, we're not required to get testing if we don't have any symptoms or anything like that. So we're getting monitored for fever every day. So you can't get to the hospital without getting a questionnaire and getting your fever, get your temperature checked. Yes. Again, if you don't have those, again, depending on which revision of the CDC guideline that's released, you don't necessarily have to be checked. Again, if you had an exposure to where you have been without your equipment, you've been out without protection, it's available for us, and it's available for us at no charge. So we have easily accessible from that standpoint, but it's not required, and we can get it done frequently. This hasn't been a situation that's come up for me personally yet, because we've, even just from a pharmacy department, has taken steps to minimize exposure directly with those patients. I haven't, me or my colleagues that I've had at most of my institutions have not had any issues. But again, for those that have, they've been tested, they've had to, you know, do their quarantine, and we haven't had any major, you know, health issues from this particular thing at this point.
That's good. That's good.